Hello, everybody. Welcome to another Good Gut Live. Happy Friday. For those of you watching live, you may know by now that you get to interact live. You get to ask questions. We can interact with you live. We're really excited to be doing that. We're really excited about this topic because it's something we see a lot. We've touched on it before in other Good Gut Lives, or for those of you listening to the Good Gut podcast, thank you so much. And it's the topic of patients come into the practice and they're like, I've spent thousands of dollars on care already. And it's this idea you're either spending thousands of dollars in like the traditional, let's say, insurance companies every month, whether it's coming out of your paycheck, it's part of your job, or whether it's just out of your pocket, right? You have your own insurance payer. Maybe you're self-employed and you're paying it. So many ways to pay for insurance. So you're spending thousands of dollars, especially if you have a wife and a child or multiple children. Or on the opposite end, maybe you're not doing that and you're then paying for everything out of pocket. Maybe you're seeing a functional doctor. Maybe you're seeing someone more integrative. Maybe you're doing a program that's really great. And all these things can be really great, but they can add up pretty quickly when it comes to your pocketbook. So that's what we want to touch on. We really want to go over and run through what we've done to save. I mean, at this point, probably thousands and thousands of dollars, maybe even tens of thousands of dollars, since really we've been a little less traditional the last 5 years. We want to run through that. We want to just really run through our mindset when it comes to this of what you can do to strategize, reorganize, and really come up with a great way to spend on health and actually be healthy and not break the bank. Okay. And I think now is the best time to talk on this for those listening live. But even if you're listening to this later, if you're listening to this later, it's already 2025, which is crazy. We're in season 2 of this podcast, which is really fun. And I think this topic is important for those listening in the new year, for those listening now. We'll even answer your questions. So it's a great time. I think this is very important because it's affected us drastically. And we know it affects all of you. We all want to be healthy. We all want to understand healthcare. We all want the best healthcare possible. And we want to talk about it. We want to see what you guys think of this. We want to, again, share what we've learned and what we do. So you ready, Dahlia?
I'm ready.
Okay. So, yeah. So, I mean, and I want to tell a little bit of our story. I remember at one point, and I remember just being shocked realizing, because for us, our life early on seemed to happen very quickly. Like for Dahlia we were on like a bullet train to adulthood, right? And it was like,
within a year.
I mean, within 1 year, it was like we graduated, we finished our dietetic internship,
started
our careers, got married, and then, I mean, that was like a huge chunk.
Basically within that same year or 2 years, we got pregnant also.
Yeah. And then we were having a baby.
Homeowners, so like a big checklist.
It was like
in a very short period of time, unintentionally for a lot of it, but
and then
some of it very intentionally.
And so if you guys want a full podcast on that, we can do that. But to skip, I mean, that's a lot to skip over. But then at one point when we were in our careers, and I was kind of just looking at our paychecks and just getting a little deeper into our finances and going, wow, like we spend a lot on health insurance that we don't really use.
Because leading up to that, right, you don't really know. I was always on my parents' insurance, didn't know how much they spent on it, didn't care. Like, I didn't really even understand. When I would go to an appointment, they'd tell me you have a $20 copay. And I was like, I don't know what that means, but here's $20. Or
there you go.
They would tell me this is your deductible. And I remember hearing, my mom on the phone with her insurance carrier saying, whatever, I have these 3 insurances and I shouldn't have this deductible. And I was like, I don't even know what you're talking about, but I'll figure it out later. So then adulting came along and we were like, what?
Like, wait a minute here. So yeah, with that, it really was shocking, because for me, I didn't grow up healthy, but I didn't have any issues I was really going to the doctor's office for.
Probably needed to, but didn't.
So at that time, when I looked at, okay, our employer is spending this much, and then this much is coming out of our paycheck, and it was for a family of 3. We were spending I mean, that combined was like almost $1,600. I remember looking at a month. And that's not out of our pocket. Again, it was our employer plus us. But still, I'm like, wow, our employer's putting this in and we're putting this in. And what are we getting from it? When you add that up after every paycheck, every month, over multiple years, it's like, wow, like that was shocking. And so,
Mhm.
and then for
But
us, or go ahead.
I think especially considering the context of
Right.
the usage of the insurance, because yes, I do have a chronic autoimmune condition, so I do need to check in with my care team
Hmm.
every so often. I do take thyroid medication that I have to take. So it's not like I can just not see my care team. So I am somebody who does use my insurance or use some type of health care with
Yeah.
getting blood work done, getting a prescription, picking that up, paying for the prescription.
Hmm.
But, James really once a year he'd go just get a physical just to make sure all was
Get
well.
blood
And
work maybe.
I
And
was
really,
like,
if I'm being honest, at that time I'd get blood work like once every 4
every
years.
time I could force him, I was like, "You need to get
This
blood
was like
work
over,
done."
this is like 10 years ago, roughly.
Yeah.
Yeah.
But even, when we were students in college, like you never even utilized the student health services that was included in your student tuition.
Oh,
You could have gotten blood work done. You just chose
didn't do
not
it.
to.
Too busy, right? Like all
Huh.
of us. Shout out to the too busies out there. We always have excuses.
I'm not one of you. I want all my blood work done. I want to know everything I possibly can.
Yeah. But yeah, so that's very relatable. Yes. And then so by the time you kind of like, wait, what's going on? And you take a look and you're like, wow, okay, so what's going on here? And then for so many that we see, and we see this in the data, I mean, we see our CD, we see this, the let's go at the macro, the bigger level here. We are failing as a nation. We are 58th
Mhm.
in terms of health. That might even have changed. It kind of changes when we look at the data, but we're pretty low in terms of the healthiest country we could be in the United States. When you look at CDC data, we're still number one killers are chronic disease, that can be prevented. So a lot of preventable, bless you, Deli,
Thank you.
a lot of preventable diseases are our number one killers. And so when we look at, I mean, look at heart disease and diabetes, and you look at cancer, and you look at even preventable deaths, you look at healthcare related deaths, we're doing pretty horribly.
Yeah.
And everyone at least, and we're looking, this is going to be almost everybody, almost like 1 in 2 people will have at least one chronic disease by 2030. By 2030, we're expected to spend 67 trillion globally on healthcare, which is like a number that I
Right.
can't even, it's not 67 billion, it's 67 trillion. Craziness. So it's like, okay, we're spending on healthcare. What healthcare are we actually getting if we just keep spending and
Well,
spending?
I know that we need more of care, but I don't know that we can call it health care because now
Right.
we're seeing, shocking statistics like 38% of 12 to 19-year-olds are pre-diabetic.
Mm,
So they certainly need the care. But the question is, how much of that care is being invested into what actually improves things,
mm,
reverses some of these preventable conditions,
right.
keeps people from becoming sick in the first place and really needing sick care?
Mhm.
Um,
Yeah.
and it's a systemic problem, and that's a bigger
That's a
conversation
bigger,
for us
yeah.
to have. But we're spending more and we're not becoming healthier. So where's the disconnect?
So now we get into, okay, well, what did we do that I think is working for us? What tips can we offer? Again, this is again showing you how to afford truly amazing care, and I want to get into that. So I think number one that I put is like priority, right? Because we all
Mm,
have priorities. So I put that as really number one. So it is understanding that, okay, if your health is a top priority, even if it's top three, great, you're on the right track, right? And it's really assessing, okay, my health. And when you're young, it's maybe not, right? If
mhm,
you're in your early 20s or late teens, if you're just, starting out, maybe your health, you're not even really thinking about it, especially if you don't have any symptoms going on. Maybe you don't realize you have symptoms. You're not fully aware of what's going on. So in this, take time to be aware. Do you have symptoms? Do you have a chronic disease
mhm.
that maybe you're on your parents' insurance or your husband's insurance? You're not really thinking like, wait, how much are we spending on this, and how often are we utilizing this care? So it's kind of this reflection that then turns into prioritization a little bit, right? What are your priorities? Are you okay with spending a lot of money on your house and your car and your clothing, but when it comes to your health, you're like, I don't want to go see this whatever doctor out of network and have to spend, even if there's a copay of $80. I'm not spending that. I'm not going to spend, a hundred and something dollars on supplements. But on the flip side, again, priority. I mean, if you go to Disneyland, you're gonna spend. I mean, depending how big your family is, and depending on the trip, you could spend anywhere from $500 to $5,000, right? If you go to a bar, per drink now is like $18 plus tip, depending on the drink and how many drinks. You could spend anywhere from $20 to $200 just on a couple hours at a bar, right? So it's understanding, okay, what is my priority here? If it's hard to have both, of if you're heavily spending in other areas and then you're like, okay, now I'm going to spend on my health, you kind of need to have that balance and that shift of priorities, which we had, which we did. We went like, okay, what are we spending on? To be honest, at one point we were kind of house poor, just starting out. We are like putting everything into our house, but I was like, what? Like, why? And our house, we weren't even the biggest fans of it, to be honest. And we're like, wait a minute, what are we doing here? It was like a starter home. And we're like, huh. So it was a shift. We had to kind of look inward, think, talk, and analyze those priorities. So that is very, very important to do.
And we certainly did that with our healthcare, and really just assessed, okay, what are we spending on? At that point that we really started to realize this and have that conversation, we were already looking into more integrative care. So we did have kind of traditional employer insurance, and we were taking Layla to more of an integrative functional pediatrician, which wasn't covered by insurance anyways. We could submit our super bills to them and they would reimburse us a portion of it. But we were already kind of on that trajectory. We were already paying out of pocket to see the chiropractor or paying out of pocket for supplements, and really just recognizing, okay, we're spending a lot of money every month, over $800, $900 out of our own pockets every month for this insurance. How is that benefiting us? What would be the cost if we didn't have this traditional insurance? So that's where we started looking into some of our options.
Yes. And so what I want to start with is the type of person who maybe you weren't really like us and you are having a little bit more health problems. This is where traditional insurance can be helpful. If you are chronically ill, maybe you have cancer, or you have IBD like Crohn's and ulcerative colitis, you're
And
constantly
you need infusions and medications that are really expensive.
right. You're on biologics, you're on insulin, you're on, you need health insurance. Let's start there. What you can also realize is you can do what's called a HSA or FSA plan. There are ways that anything you are spending out of pocket, including any out of pocket specialists or supplements, you can get a tax write-off.
And that stands for health savings account or flex spending account. So we had that when I was at my last employer. I was the one who provided our family with health insurance, and I learned about HSA and FSA, and I was like, oh, cool. Okay. So that is money that is pre-taxed and going into this savings account every month. And we're deciding how much gets taken out of my paycheck to be put into this health savings account or flex spending account. And you can only use those funds for healthcare related services and healthcare related expenses. So you can buy glasses with them, or go to a chiropractor, pay for your supplements, or do something related to healthcare, pay your copays with it. So if you recognize I'm spending whatever, $100, $500 a month, if you have the option, you can elect for an HSA or an FSA.
Thank you for watching this. We hope you know by now, Married to Health really does everything we do coming from a need in our community, a need from our patients, a need from being dietitians for over a decade, from running our own private practice. And we continued that when we formulated Gut Nurture. So if you didn't know, Dahlia Marin RDN, LD, CGN, formulated gut nurture along with complement. We truly believe it is a great complement for your gut health journey. Why is that? Well, it's low histamine, it's low FODMAP, it's organic, even the package is compostable. We really designed it with the patient in mind that is wanting to eat more plants, that needs to eat more plants, but is struggling to eat more plants. This is that bridge. We also designed it for the person who's just like, I want to boost my gut, I want to feel really good, I want to help with the structure, function, and population of the gut. This is unlike anything that's really out there in that as it's focused on being a prebiotic, not really a probiotic. So the idea here, you can think of gut nurture as compost for your gut ecosystem. It's not trying to force seeds and the probiotics in, it's trying to create a beautiful environment and a beautiful foundation. So any seeds you get from the fermented foods you're eating, from your environment, from the beautiful habits you're building, whether you're working with us or not, they are going to fall on this beautiful, healthy soil with this beautiful, healthy compost and create a lush, beautiful ecosystem and garden, creating an abundance of fruit and postbiotics that are going to keep you healthy and thriving. So click down below, learn more about gut nurture, and we'll continue with the episode. That is huge. That's a whole nother episode of taxes. So understanding your taxes is huge, and the tax saving really just adds up every single month. So to not pay taxes on certain aspects that you're spending on every single month is huge. So that is huge. Now, if you fall into another category where maybe you were like me, where like I never use my doctor's visits. I never really go into, I don't recommend you never get labs done. I don't recommend that. But if you're like, I don't see a doctor, I don't have a specialist.
You should.
I mean,
Or
you should have it.
see someone.
I'm not saying I had a doctor. I have a
Yes.
doctor, but I never went in. I was like, I feel great, so I'm not going to go in. If that is more you, if you fall into that category, then there's health shares, right? So there's health shares which can replace your current health insurance. There's one called Christian Healthcare Ministries. They're typically, these health shares are faith-based and religion-based. They're part of a section of this that is a faith-based, some, I guess you can call it a loophole in a way, but what it is essentially you're putting in money to then cover everyone's costs if you were to fall ill, if you were to get into a car accident and break your arm or need life-saving surgery. And there's different tiers of this. Again, there's lots of details to go into, but it's really really saying, wow, there's other options out there. That is what we went through. We found that even with paying for what Dahlia needs out of pocket was far less than what we were paying every single month through our employer, plus through our own pocket out of our paycheck. I mean, what we pay out of pocket for Dahlia's care is a fraction. And on top of that, we see a chiropractor. We do, I mean, what else? We do a
B12
chiropractor. We do,
injections.
yeah, she does.
Yeah, we all have our practitioners. We do blood work out of pocket. I pay for my medication out of pocket, and it's cheaper than what I used to pay with insurance. So, what a lot of people don't realize is by law, insurance has to charge you a copay. And that's a predetermined amount. So they can have a $20 copay for any medication you have. Even if that medication out of pocket would have costed $5, the pharmacy is not allowed to charge you the true cost. They have to charge you your copay. So I was paying more for my medication with insurance than I now pay out of pocket for my medication. And I pay less now that I don't have these high insurance premiums every month. I pay less for getting my blood work done, seeing my specialists who support me with my health than what I was paying before, to just pay my copays and deductibles and pay for that monthly traditional healthcare insurance. And then, James, still, we ordered James's labs, make sure all is well. If there were anything that were to pop up, we do have our go-to, specialist and our primary doctor who he can see if anything were awry. We know we're in a unique position because we're both healthcare practitioners. We don't recommend this. If you're not a healthcare practitioner or have one who can support you, please do have a primary provider that you can see.
Yeah.
Please have your labs ordered every year. But there are ways that it can be more affordable.
Yes. So that is one. So health share. And again, drop a comment down below if you want to learn more. In the description, there will be links to learn more about everything we're talking about. And so yeah, so a health share, again, you could still have a primary doctor, you're paying out of pocket, and you still have the peace of mind though that what you're paying out of pocket is far less. You can
Hmm.
still use the HSA or FSA plan. So what you're paying out of pocket is then still a tax write-off. And on top of that, you have the peace of mind that if anything really severe were to happen, you are still covered. It can go up to like $4 to $5 million of coverage.
Per
So it's
incident.
per incident, which is amazing. So there's so much out there.
Hmm.
And then really it gets into then just saving money, continuing whether you're using a health share, you have health insurance, whatever the case is, which really gets into strategic testing and having your mindset around testing. We are big on test, not guess.
Hmm.
You've probably heard us. I know we talked about this before, which is very important, but we see a lot of money being spent on testing.
Hmm.
And that is very important to understand. What is this testing doing? Why you want the money you're using on testing to be purposeful, to be meaningful, to tell you something, to help you. That is a big pitfall we see in care, whether that's with functional or like Ayurveda or more the
Traditional and
Eastern
functional.
and even traditional, right? As all this testing.
And
So
I would say traditional medicine is probably a little bit more judicious with this, but now you can order, or most people can order testing on their own. So
mhm,
they often come to me and people are like, I've ordered this stool test, breath test, hair mineral test, urine test. Here's all my stuff. And
mhm,
a lot of the times you want to ask, one, how much are you paying for this stuff? Because that can be thousands of dollars right there. Two, what are the results of these tests going to change with anything?
mhm,
Because if you're just ordering this on your own and you are unsure how to interpret this testing, more harm than good can come from that. So, especially with things like stool tests or urine hormone analysis testing, I wouldn't go at that by yourself. I had a patient actually ask me yesterday of one of these really popular commercial stool tests that's out there on the market. And she said, hey, have you heard of this test? What does it look at? What are the benefits of doing it? And then what is their goal as a company to sell this stool test? So I gave her my honest opinion. I said, hey, this is not my favorite test. It's really expensive. It's $400. They're analyzing about 30 data points, and their goal is to sell more of these expensive stool tests because then they're taking the stool and somehow telling people, which we're not there yet with the data. You can more or less make general recommendations, but they're telling people you're definitely sensitive to this, definitely should eat this and not eat that. So do that for a few months, do another stool test, and then we'll tell you if these things are getting better.
mhm,
Um, and again, I've just seen these types of tests cause disordered eating, overwhelm, confusion, steered people in the wrong direction. So I gave her my advice of I would not recommend ordering that test. I showed her, I said, I'm not against stool testing. I definitely recognize its pitfalls. We're not there yet fully with the data. But if I were to order a stool test, this is the one I order as a practitioner. And this company only allows practitioners to order the stool test so that a licensed and experienced person is going over the results with you. So I showed her that one. And then sure enough, she messaged me today. She's like, hey, my brother was the one who had asked me about that other test, and he actually wants that test that you were talking about. So, it can be really important for you to understand, like, what am I going to do with this information? How much is this test costing me? Is it worth that cost? And what is it going to change for me?
right.
Are these even
Yes.
appropriate things to change?
So that right there alone could be hundreds and hundreds of dollars. So that is a massive piece of this puzzle where it is not just, I mean, it's great if you trust your provider, you should to some degree, but keep asking these questions of what's this test going to actually do? How is it
Mm.
going to help me? What's it going to change? And ask those questions and compare. Get
Hmm.
get one, two, three, even four more quotes if you need to from other providers and understand the test fully. I know it takes time, but your time is money, your money is your money, and you decide, okay, do I want to spend a little more time and then save, hundreds of dollars down the road, especially if you need to test and retest and test and retest. So
Yeah.
very important. What I want to do is then also speak to something, or go ahead.
But I will say, I do have to say
Okay.
before we move on from this, I want to make sure people are still getting preventive screening tests and
Okay.
not trying to save money there. So we do know if you're 45, it is recommended to have a colonoscopy.
Okay.
Um, that is a worthy investment, no matter the type of insurance you have. Having that preventive testing and finding out earlier rather than later will save you so much money, right? Removing a precancerous polyp and paying for a colonoscopy, whether it's through your insurance or out of pocket, is a lot cheaper than having colon cancer.
Hmm.
Same with things like breast exams and pap smears. So hopefully, no matter the type of insurance you have, you're still getting your preventive exams because they save lives and they save
Right.
a lot of money.
Right. Yeah.
So
Good
that
one.
can't be said enough.
Yes, yes. Good, great. And what I want to say is, even so, along those lines, and this is something I never thought we'd do, to be open and honest, but going to other countries for care, where properly vetted, and again, properly doing your research, not just going to some random country because it's cheaper. Yes, that's important, is obviously not letting, again, the number one cause of bankruptcy in the US is medical debt. So that is important to your quality of life and overall just your health. But going to a different country, we go out of the country to a dentist that we really like. And we live in Southern California, so it sounds crazy. Like, you guys go out of the country. It's literally like an hour and a half drive to go to Mexico for us, or not even. It might even be shorter than that.
Yeah.
So
And we see a biological dentist.
yeah.
So they are American trained. They do even accept American health insurance. So if you have
Mhm.
dental insurance, you can still use that there. But because it is in a different country, it's a fraction of the price.
So fraction. So I had all my old. I had two old like mercury fillings from when I was little. I
Those
remember
amalgams.
the amalgam, and so to get that removed here in Orange County, it was like, okay, I could do that. The price quote was like, wow, really? Okay, I guess, because you have to understand, people are paying their rent, their facilities, the labor costs are higher. I totally get it. I understand. But if I could drive an hour and it's a fraction of that, and it's the same quality work, and the reviews are great, and I vetted the institution doing it, the organization and the doctors, and they're really good, why not? If you can do that, why not? And that also goes for when you are doing maybe a bigger procedure. I know we hear funny stories of like people going to Turkey for hair transplants. Okay, we're not really talking about cosmetic surgery. We're talking about just surgeries you need, whether that's for screenings that you need, like a colonoscopy, or whether that's something maybe a little more serious. And if you are able to do that research and properly vet and do that travel, and it makes sense for you, it can be very helpful, because you are then not having to worry about going into debt or having your coverage change, or a lot of these then stressors that come with medical care here. And let me just say here, this is where we need a massive overhaul of our current healthcare system here in the US. We are one of the most vibrant, wealthiest nations in the world, and yet our healthcare and our public health systems are extremely subpar.
Hmm.
So it's exciting to see what's happening, this overhaul and this change that's happening. We need a lot of change. Most importantly than electing anybody or putting in a leader, it's important that you are all taking initiative. You are all individually responsible for your health. I know this isn't like, it's not fun to be like, oh man, I got more responsibility, but you have responsibility to hold these government officials, these institutions that are in place in our own country, holding them accountable. Where if there is lobbying going on, if the health insurance companies are jacking up prices, or I should say pharmaceutical companies are jacking up prices, and the health insurance companies are kind of playing into that, we need to go, hey, wait a minute, what's going on here? We need to look at this further. And we know through court documents, through lawsuits, and then record releases, we're seeing this happen. We know for a fact this is happening. So there's a reason why this is the number one cause of bankruptcy in the US. It's because there's corruption and lobbying going on. So that's a whole nother rabbit hole. But it's very important to understand why there's this kind of symptom, this larger macro symptom going on of people not being able to afford care.
And it's not, it's interesting because then I see people from all around the world. So I do see
Hmm.
people who live in places like Canada or the UK who have, government funded healthcare. And it's still there are still these issues. Yes, they can get screening exams that are completely covered, but there
Waiting
are
6 months.
shortages of specialists because they're not as well paid there as they are here. So we pay more for our health care here, but then our specialists are paid more, so we have more of them. So yeah, you can get a covered colonoscopy, but you have to wait 6 months to get it sometimes. So even in other countries,
Hmm.
my people who have NHS or they have the Canadian insurance, they're still going out of pocket, and they're still seeing specialty providers
Right.
or private practice providers who don't have that same weight. So it's hard because we have issues with our healthcare system here. I feel like everywhere there are issues with healthcare in general.
Yes.
Um, so yeah.
Yeah. Okay. So, and let me know, guys. Just check one too if you guys can hear us. Okay. I just saw a comment come in through Instagram that you can't really hear. Okay, so let me know. So again, this is part of Good Gut Live. We're live and we can see your comments and your chat. So let me know if it's maybe it's that person. So I'm hearing that there's audio. So maybe that's check your devices. Okay, well, wonderful. And then yeah, and that segues into just understanding health insurance, right? Understand that here in the United States, it is for profit, and that segues nice into yes, you can have government funded health insurance, which technically we're really interesting here in the US because we have both. Like a lot of our tax
Yeah.
dollars goes to fund healthcare, right? When we're talking
Medi-Cal,
about
Medicare.
right. Medicaid is the national
Mm.
coverage here in California. We have Medi-Cal, which is a form of Medicaid. That is our taxpayer funded healthcare for low income and elderly populations, which is
Or
Medicare
disabled.
or disabled. And so we do have that. Does that work? I mean, it's care. Are they optimized and healthy? I don't know if I could say that.
Mm.
Then we do have the out of pocket, right? Where we do have for-profit healthcare fees, and when you're looking at it from their perspective, they're business. So they want to take your premium that you pay every month, you pay them an amount every month, and here you go for my healthcare. And then when you want to use it, and let us know, and you can comment down below if you find it's easy to use your healthcare and your reps are really helpful, it's easy to understand, and it's so easy to find a doctor or the specialist you need, and you're getting excellent, amazing care, and you're actually coming away healthier from it. I don't know if we can all say right from this for-profit kind of network. So it's interesting.
It is interesting. And we have the unique experience of being both consumers of health insurance and then recipients of health insurance payments, because as a practice, we are in network with insurance
With
payers.
PPO insurances,
So
yes.
we have we hear a lot about insurance because our patients, some of them use their insurance benefits with us, or we are calling insurance reps as a business and speaking to them. And
Mhm.
so we have the unique opportunity to kind of see both sides of what it is to be just a consumer and a payer for insurance, and also what it's like to be a medical practice who accepts insurance. So it's really interesting, and, if you have questions about insurance as far as nutrition goes,
Yeah.
those are things we can ask.
Thank you so much for watching this video. We know you're probably getting quite a bit from it. It can be a lot of information, it can be overwhelming, and we totally get that. Dahlia was there not too long ago suffering with IBS and SIBO-like symptoms. She was hunched over very often, bloating, gas, constipation, diarrhea, skin issues, hormonal issues, the list goes on and on. So we know this. We've been in practice now as registered dietitians for over a decade, and we created our Good Gut SIBO IBS program for you. If you're experiencing IBS, SIBO symptoms, IMO, SIFO, the list goes on and on. If you're like, I'm not really sure what this is, click down below. We have a free assessment for you, and that'll likely lead you to our Good Gut SIBO IBS program, which is chock full of information we wish we had. It's information that we're giving to our patients, so it's all at your fingertips in one package. It's 7+ hours of video. It is dozens and dozens of handouts. It's tailored meal plans and recipes to truly help you get to the root, to truly help you understand what's going on so you can truly heal with each meal. Check it out down below. Yeah, I'm seeing, can I ask a question? Yes, you're welcome to ask questions. And yeah, so we see this, like Dahlia is mentioning, from different angles. So it's important to understand the different angles in which we're seeing this. We understand the frustration. Part of my job in Married to Health is reducing the headache. And I remember early on, we'd hear from insurance reps and they'd go, yes, there's cover. They tell us one thing. And then as we're getting into care and submitting claims, they're like, oh, no, that's not what we said. Or no, this coverage isn't what we thought it was. And you're like, well, what the heck? The insurance rep told me this is what it was, and now you're changing it. How does that happen? They just go, whoops. And so then
Or they'll say, we gave you money 6 months ago, but actually we decided we don't want to give you that money. So give it back to us.
yeah, which is actually a letter I recently got, like, oops, we gave you an overpayment. It's like they call it an overpayment. So you feel like, oh, you overpaid us. But really what they're saying is they go, oh, we were wrong about this coverage. Now give us the money back. And we're going, really? So the health insurance model is that of we'll make it easy to take your money. We'll set up in a way that your employers can give us money. When you want to use the services, oh, we make it a headache. From the portal to dealing with the providers, paying the providers, it can be quite a headache. So understanding that it's a business, right? And understanding that, especially, it can get extremely political when then we're mandating you have health insurance. You have to have health insurance. You have to play into this model of give us your money and get subpar care. These are all issues we need to address. These are all questions we need to ask. And really, to go full circle back is really why we want to say this should be more and more incentive of you to actually be healthy, right? This should be even greater incentive to be like, I don't want to play this game anymore. That's really what Dolly and I did, where we have this greater incentive to eat healthier, to exercise, to be more spiritual, to pray or meditate, to um, deal with emotional trauma, and take time to do that. I'd rather take time and resources to do those things and have these great outcomes that to take time and resources and put them into traditional insurance or these antiquated models that aren't working and get no outcome or get an even worse outcome. So these are hard questions to ask. This topic can be one that people go like, oh man, I feel uncomfortable. And that's what we like to do a little bit is it can be a little difficult. It can be uncomfortable. Being uncomfortable means you're growing. We're seeing some questions come in. My insurance, which includes Medicare for the most part, it works for pure allopathic medicine, right? Totally got to take care of myself, so I hopefully don't need the rest, right?
Yeah.
Exactly, yeah, so at the base, like, if you're on Medicare, it's covering the allopathic, which means like, hey,
Preventive screening and
right,
labs and yeah, just kind of like a 7-minute doctor visit.
hi, come on in, boom, 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 see you later,
Here's your
right? Here's
prescription
your
or
prescription
lab order,
refill, right, lab order,
which
but
is fine.
right.
You can incorporate that also, yeah, invest in nutrition and invest in some of the other things. It doesn't have to be one or the other. It can be both for sure.
But unfortunately, like for Medicare, for example, when it comes to covering a registered dietitian, it's not really preventive.
No, not at all.
Insurance uses the term. What's funny is on the back end with insurances, they say preventative coverage, but the preventative coverage in insurance language,
Has stipulation.
it has stipulations, but it also means you're already
Have to be overweight or obese and have either hypertension, which is high blood pressure, high cholesterol, or family history of cardiovascular disease, heart disease. That And only that will qualify somebody for preventive visits. With most payers, with Medicare, they only cover nutritional visits if you have existing diabetes or existing kidney disease. And you only get a year unless your doctor can convince them that you need more.
And so think about this, and you get, I can fact check the actual amount, but think of the billions and billions of dollars we as tax-paying Americans put into Medicare for then it to only cover when you're trying to see, let's say, integrative dietitian or nutritionist or trying to actually get the real preventative care, it doesn't cover that. Like, that I think needs to change, right? That is something that's not really working, right? And you can see that in the outcomes that we're seeing across the board, really. So
Yeah.
this is where it goes back full circle, where we've given you some things to think about. We've given you some of what we've done, but really at the end of the day, it is prioritizing your health. It is prioritizing that time and energy to, yeah, go back to your nutrition, go back to your mental well-being, your emotional well-being, in order to prevent the rest, in order to prevent the headache of feeling like you're spending tons of money on health insurance but not getting anything in return, or if you're younger, really saying you're in this position where you haven't taken care of yourself, so now you need health insurance and you can't really get out of this kind of dysfunctional cycle and model that we're seeing. So it's
Mhm.
very important, and we are going to be talking more on this. Definitely stay tuned to more topics on health insurance for sure.
Yeah.
Say something.
Well, I mean, the last thing that I wanna kind of touch on, because this
Mhm.
is something that I hear from my patients. Not all of them, but, we have some patients who provider hop,
Right. Yeah.
and they are following everyone. They see 8 different providers in 1 year, don't follow through with any of the recommendations, and then they've spent a lot of money on those visits. Maybe they've tried a few things each person has recommended, and then they come back and message, and they're like, "I've just spent all this money and I'm not better. I can't afford to see you again." So it's also just as a patient, really understanding, 1, research your practitioners so you know who
Yeah.
you're investing in, especially if it's something that you're paying out of pocket for. Um, Recognize the limitations of each practitioner and limitations of different things that you're doing, like online programs or taking random recommendations from someone you follow on Instagram. Um, because, yeah, it is hard when people do that, and, it does happen from time to time, and then they're like, "You get information for free." And I have to unfortunately say, no, it's actually illegal for me to do that. If I haven't cared for someone and seen them for a visit in over 6 months, I don't know what's happening with that person. I don't know what medications they're currently taking, symptoms they're having, supplements they're taking. I can't
Mhm.
just recommend random things. That would jeopardize my own license. Um, so if you're, somebody who is tempted to do that and blow thousands of dollars on all this testing and 8 different providers, and then you're like, "Wait, I spent all my money that I had allotted for my healthcare," you might wanna re-strategize. It's not legal for practitioners to practice like that. So, going
Good
back to
point.
kind of just what James was saying, really prioritize.
Mhm.
W Is this affecting my day-to-day life? If that's the case, vet someone, find 1 or 2 practitioners that you really, really wanna work with, and see it through. You're often not gonna feel better in the first month or 2, especially if you've had gut issues or whatever, health issues for decades. It's seldom that 2 months of working with someone is gonna make you feel better. So don't get discouraged and then hop to someone else, then someone else, and then someone else, because 'cause you're just gonna get yourself deeper and deeper, not only into debt, but into confusion and into overwhelm. You'll be that person who ends up with those $10,000 of testing, but 0 solutions that have worked for you,
And then you're
because sometimes
almost
you just need to spend time.
and then you're almost worse off than when you
Oh,
started, because
almost always
now
worse off.
you have debt, you're stressed, you're upset, you feel like nothing's working, and you're still with your symptoms. So this is where, yeah, unfortunately and fortunately, financial literacy and understanding what is happening your insurance and what you can afford is so important, guys. That's why I started with that really is understanding and prioritizing this and taking that time to understand it. And if you need help, reach out. You can reach out to us. We're happy to give you resources. Click below for some resources as well. And you can go to marriedhealth.com to learn more, to reach out, hit the contact us. We're happy to point you in the right direction.
We don't want you to be part of that statistic of medical debt causing bankruptcy for any of you,
This is
and
actually stress,
trauma,
trauma.
medical trauma is
Yeah.
prevalent. So we don't want this financial trauma to be one of yours. So
Yes.
yes, hopefully you seek out practitioners who kind
Mhm.
of understand the ins and outs of insurance, different options, and then what you can do to work with the most qualified, most specialized person and not for you.
And apologies, guys. We did have a link issue earlier on the original link. Our system is a little bit change something. So, it's part of life. We're always changing. But if you're watching this later on, thank you so much. Find us Good Gut Live on Spotify, on Apple, anywhere you find podcasts. And we thank you so much for subscribing to our YouTube, watching this live, whether on YouTube, Instagram, or Facebook. And we appreciate you all so much. Any
Mhm.
parting? We're trying to this can be a very heavy topic. If you want a part 2 to this, let us know, but we try to keep it pretty simple, straightforward, giving you some of our real world, tips and strategies, as well as just touching on this topic, which is so important, is understanding your health insurance and your healthcare and what you
Yes.
can afford.
Make it a benefit, not a debt. Know what you're
Exactly.
getting yourself into. Ask the right questions. Find the right providers. If there's someone you love, you really want to work with them. Maybe before you renew your insurance, ask if they accept that.
That's a
Or,
good one, yeah.
yeah, if you are going into a flex spending account, health savings
Mhm.
account, or health share, know how much you can allot and how much working with some
Yeah,
just a couple of our parting tips. And we hope that this helps you heal with each meal because sometimes if you can't afford that care, it's hard to understand how you can feel with each meal, and just continue to thrive.
alright, everybody. Until next time, thank you so much for your support of Good Gut Live. Thank you. Bye,
Bye.
everybody.